Let's dive right into this explainer and demystify a condition that literally affects millions of men as they age. Benign prostatic hyperplasia, or as it's commonly known, BPH. Now, if you or a loved one are suddenly experiencing new, let's face it, highly frustrating bathroom habits, you are absolutely not alone. Today, we're going to unpack exactly what BPH is, why it happens, and most importantly, what you can actually do about it. Here's our roadmap for today. We're looking at the anatomy of BPH, the signs and risk factors, the real dangers of ignoring it, mild treatments when surgery becomes necessary, and finally, taking control with everyday lifestyle changes. Okay, section 1, the anatomy of BPH, the plumbing problem. To really grasp the solution, we first need to visualize the mechanical issue going on here. So here is a pretty wild biological fact. For reasons we don't entirely understand, the prostate gland essentially never stops growing as you get older, right? It's just a tiny walnut-sized gland tucked just beneath your bladder, and its normal day job is to produce fluid that combines with sperm cells to create semen. But as the years tick by, that little walnut just keeps expanding. To picture this, think of the urethra as a pipe, and the prostate is a walnut wrapped tightly around it. Under normal conditions, everything, urine, semen, flows totally freely through this pipe out of the body. But when that walnut grows, the pipe gets squeezed. The enlarged prostate compresses the exact part of the urethra running right through it. It physically restricts that space, which, as you can imagine, effectively slows down the flow of urine out of your body. It's a literal bottleneck. Moving right along to section 2, signs and risk factors. Who is exactly affected by this? Now, you might be surprised to learn how many compounding lifestyle factors can bump up your risk, alongside simply crossing that 40-year mark. Obviously, age and a family history are primary drivers, things we can't control. But look at the rest of these factors. Conditions like obesity, heart and blood vessel diseases, and type 2 diabetes all crank up your risk. Even a lack of regular exercise or experiencing erectile dysfunction are linked to a higher likelihood of an enlarged prostate. It just goes to show how incredibly interconnected all our body systems truly are. So how do you actually know if that walnut is squeezing your pipe? Well, the most common symptoms are, frankly, incredibly disruptive. Are you experiencing that maddening urge to pee multiple times a night, completely ruining your sleep? Or maybe you have a noticeably weak or constantly interrupted stream. That is highly likely the enlarged prostate stopping your bladder from emptying out entirely. You might even find yourself physically straining to go, which is a textbook mechanical sign of that compressed urethra. That brings us to section 3, dangers of ignoring BPH. Why taking action really matters. Listen, a slow stream isn't just the minor brush-it-off annoyance of getting older. It can rapidly escalate into some severe complications if you completely ignore it. Over time, that squeezed pipe can reduce urine flow so much that you literally lose the ability to urinate. And this backed-up plumbing, it can cause permanent damage to your bladder and your kidneys. Plus, it creates the stagnant environment that practically invites nasty UTIs, painful bladder stones, and can even lead to blood in your urine. This is exactly why getting to a doctor right away if you can't urinate is absolutely vital. Okay, on to section 4, medications and mild treatments. Let's talk about early interventions. If your symptoms are fairly mild, or maybe you don't even have any noticeable issues yet, your doctor might just suggest something called watchful waiting. This is exactly what it sounds like, just keeping an eye on things with an annual checkup to make sure the prostate isn't stirring up new trouble. It's a proactive, yet totally hands-off approach. It basically ensures your baseline health isn't declining before you jump into any active treatments. But when those symptoms become moderate and really start bothering you, doctors generally lean into one of two medical approaches. You can either relax the surrounding muscles for quick relief or use medication to physically shrink the prostate over time. Muscle relaxers like alpha blockers or PDE5 inhibitors, which, by the way, are also used for erectile dysfunction, work by relaxing the muscle tissue in your bladder, the urethra, and the prostate itself. It essentially loosens the grip on that pipe. On the flip side, prostate reducers, like 5-alpha reductase inhibitors, get right to the root of the volume problem, actually shrinking the size of your prostate over several months. And quite often, doctors will actually prescribe a combination of these drugs to give you maximum relief. Moving into section 5, when surgery is necessary. Let's look at advanced procedures. The most common surgery out there is called a transurethral resection of the prostate, or TURP for short. Don't let the name intimidate you. It's a routine, minimally invasive process designed to just go in and clear out that physical blockage. The surgeon inserts an instrument called a resectoscope directly into the urethra. Then, using a specialized wire loop at the end of the tool, they literally shave off the excess prostate tissue from the inside out. By removing that extra tissue, the urethra is widened back out and normal flow is immediately restored. Now, if a physical wire loop isn't their go-to, we have some truly incredible modern technology to do the exact same job. Surgeons can use tools that emit lasers, microwaves, radio waves, or even electrical energy. All of this is delivered through that same resectoscope to safely destroy or remove the excess tissue. It's just a fantastic example of modern medical engineering giving us a whole menu of minimally invasive options. That being said, for exceptionally large prostates, a minimally invasive approach through the urethra just might not cut it. In those specific, more extreme cases, doctors will perform an open prostatectomy. This involves a direct incision in the lower abdomen so the surgeon can completely expose the prostate. They make an incision into the outer capsule of the prostate itself, reach right in and remove that obstructing tissue directly. Finally, they close the capsule and the skin incision with sutures or staples. So yes, it's a bit more involved, but it is highly, highly effective for severe enlargement. All right, our final section, section 6, taking control with lifestyle, everyday habits. This is where you can take charge. Adjusting just a few daily routines can drastically improve your symptoms, especially those super disruptive nighttime bathroom trips. First off, try to steer clear of over-the-counter antihistamines and decongestants, because those can actually make it harder to pee. Next, give yourself a hard cutoff time for liquids. Literally, stop drinking fluids a few hours before you hit the pillow. And finally, avoiding alcohol and caffeine entirely can make a massive difference. Both of those are notorious for irritating the bladder and ramping up urine production. And hey, have you ever heard of something called double voiding? It's this remarkably simple daily hack that trains your body to ensure the bladder is completely empty. It really helps prevent those frequent, frustrating return trips to the bathroom. Here's how it works. You just urinate normally, wait a brief moment, and then actively try to urinate again. It's a tiny mechanical trick, but it forces out that residual urine that the enlarged prostate might be stubbornly holding back. As we wrap up this explainer, I want to leave you with one simple thought. We've seen exactly how this whole plumbing problem works, the compounding risks, and the honestly incredible array of treatments out there, from watchful waiting and daily habits all the way to advanced surgical tech. BPH is a highly treatable, highly manageable condition. So if your body is sending you signals tonight with frequent wake-ups or a weak stream, will you take that empowering first step and talk to your doctor? The tools for a better night's sleep are right in front of you. Don't let a growing walnut dictate your quality of life. Thanks so much for joining me on this explainer, and be sure to take charge of your health today.